Okay, good afternoon, everybody. We'll go ahead and get started with our presentation today. My name is Dr. Christopher Gillard, professor at Xavier College of Pharmacy. Also, as far as who's here with us today, representing Xavier, we have Dr. Elder here. We also have some students here talking about a community presentation. Today, we're going to talk about clinical trials and the relationship to the community and those particular things. So, we're all going to get a chance to talk today and have some perspectives about clinical trials. So we're talking about the importance of community voices in research. So we'll talk about clinical trials. What does it mean for the community? Some barriers you may encounter in clinical trials, the benefits, and some disease states that may be encountered as well, may be involved in the clinical trials. And also talk about, the relationship with COVID and flu as well and vaccination. So first of all, what is a clinical trial? How would you guys describe what a clinical trial is? So we're talking about studies, right? So before a medication gets on the market or a shot or vaccine gets on the market, we have to study it. So we do a lot of research. Are these things effective? Are there side effects? And that can take several years. And sometimes we've been studying drugs after they get on the market as well too. So when we talk about a clinical trial, it looks at specific medications or behaviors in a specific group of people. They help to create new drugs, diets, disease guidelines, and medical devices. So if I put this gentleman on a blood pressure medication, it's not because how I feel about it. It's usually based on disease guidelines that have said this medication has worked in this amount of people. So that's a clinical trial. So in the community, clinical trials are typically located in large universities that are difficult for patients to access. Everyone can't get to certain areas to get a clinical trial. That could be a challenge. Community-based clinical trials address this issue. So a person doesn't go to that big university they can't get to, usually can do something right in the area. That's a community-based trial from that perspective. So location is a benefit to us. Patients can get care they need without traveling far, right? So if I cannot get to Baton Rouge to see this provider, maybe I can get a clinical trial. Diversity. So that's one of our biggest benefits as well too. We want very different people in our clinical trials. People like us, people of different ages and backgrounds, different disease states. The more information we have, the better we know about certain medications as well too. So we want diversity. Trust. So community-based trials, coming out to you guys here today, hopefully we can build trust from that perspective as well. Um, or if there's a clinical trial going on, we can build that trust going to community itself. And also better communication. That's a big part as well too.